way into working with seniors. It's my passion. Why is it my passion? Because I had two seniors at home, which are my parents. Unfortunately, my dad passed away in the beginning of this year due to COVID. And, I was their caregiver. I am my mom's caregiver, so I know how important it is to help and support various issues when it comes to health in the senior population. So to answer that question, COVID has adversely affected a lot of seniors, especially the seniors who are aging into retirement, turning 65 in Medicare. Why? Because Social Security has closed down their offices and they're operating remotely. So everything has to be conducted over the phone or through the internet. And although we have a lot of savvy computer literate seniors, we have some seniors that don't have access to those resources. So therefore, it is prolonging the process for them to apply for Medicare once you retire, and it's taking much longer because the information is transmitted through the internet or via the telephone. You're waiting various long times to get an appointment to do a telephone call for an entity to apply for your benefits. So it has impacted the seniors a lot. Even the ones who, let's say now 65 is not the really normal age to retire. A lot of people are working past 65 and you are receiving benefits from your employer, but sometimes it's more cost effective to apply for Medicare depending on how much you're paying out of your paycheck every month or every week, however it is you get paid bi-weekly, semi-monthly, or weekly. It does make a difference once you reach the age of 65. So we are impacted also with the senior centers who are closed now, but right now they're reopening because of COVID, but it's a limited capacity. So I'm happy that they created this platform today so we can share various resources, because there is a lot of information and resources, believe it or not, that you don't know about. Every time we're in the street, we're marketing and we're asking people, do you have health insurance? A lot of people say, yeah, I'm covered, I have everything I need. I beg to differ, because a lot of times you may think you have everything you need, but you're probably overpaying for your specialist. You probably have a high deductible plan. We do a real deep analysis when we sit down with a senior and we ask them, what do you want to get out of your health insurance plan? What do you want to maximize? The best way that I describe it is like buying a car. It depends on what you're looking for. It's the same thing with health insurance. Not all of us have the same conditions. Some of us are healthy, some of us are not. Some of us require more medical attention. So this is where we come in and we direct you the proper way, and we enroll you in the plan that best meets your needs, because it's on a case-by-case basis. So we're here marketing in the community. We have various resources. If you want additional information, you can come to the Emblem Health table. I have two representatives, Jennifer Ellison and Nordia Gordon. They're waving their hands. Feel free to stop by. We have masks, we have giveaways. Please, no question is a stupid question. Ask as many questions as you want. We have a lot of great plans for everyone. We have unlimited dental. We have over-the-counter benefits. We have two plans, one that gives you $125, one of them gives you $155, and we also have a plan for veterans who they also seem like they feel that they have all the benefits they need when they go to the VA hospital, but we also have additional benefits for veterans as well. So we have a plan for everyone. Again, we're here, we're available to discuss in private, or we can go to your home. And for some of you guys who are a little COVID, scared, we do telephonic enrollments as well, so we can schedule a telephonic conference call to review your benefits. Thank you so much.
Hi everybody, my name is Caitlin Arias. I'm the Director of Business Development for Growing Home Care. I'm also a nurse by profession. So what we do is we provide short-term services for seniors at home. So that's the physical therapy, nursing, occupational therapy, speech therapy, and social work. So if anybody ever goes to the hospital and needs services after they leave, we send a nurse the day after you're discharged, as well as from a nursing home. We service Brooklyn, Queens, and Manhattan. So as COVID obviously has impacted us all, but especially the senior community, you don't want to leave your home. So that's where home care comes in. A lot of our nurses are either vaccinated or COVID tested weekly for your protection. They go into the home, they evaluate you, they can actually show you their COVID vaccine card if you ask. And you know, going outside is a difficult thing because you don't want to go in, you know, any doctor's offices and, you know, possibly get infected. So we have doctors who actually either come to your home or they can also do a telephonic visit. In order for you to qualify for the service, the doctor has to say that you need it. There has to be a skill in the home. You know, either you're having more trouble walking, wound care, something of that nature. So our doctors will call, speak to you at home, in the comfort of your home, and give the home care in order to start the services. And then you can request a COVID vaccinated nurse, and if we have one in your area, we send the nurse to your home to evaluate you for the services. You know, like I said, we're all impacted by it. It's a very difficult time right now, but we try to make it easy for you and easy to access services at home so that you don't have to go outside and you don't have to, you know, put yourself at risk for catching COVID. Okay? Thank you very much.
I'm sorry, I just want to add that we, because she touched a good subject of making it easier for you. My representatives can actually also help you apply for your Medicare benefits and other resources that are available that New York State offers, such as the Medicare Savings Program, which helps cover your Part B premium, as well as EPIC, which is an elderly pharmaceutical program to help you pay for your prescription drugs. So we are available. We just don't do health insurance. We also are able to assist you and navigate you in the process of health care. Thank you.
Hi everyone, my name is Reverend Johnny Howard. I represent Bragg Home Care, and what we do is offer long-term home care service for a lot of our elders and seniors in the community. But more importantly, there is an aspect that we do assist seniors with, is applying for Medicaid. I'm quite sure they do the same. What we're finding is that a lot of our elders and seniors in the community, when they apply for Medicaid, they realize that they're not qualified for it because of some technical reason, or maybe they're over the limit by $30 or $40 and they get turned down. So we try to educate you both on the spin down and the pool trust options, which we will talk about later. But we, as I said before, we offer long-term care services in which you can obtain through Medicaid, which is the managed long-term care for home care services.
Awesome, thank you. So what have you heard so far? I heard teleservice. I heard you can get a doctor to come to your home, vaccinated of course, right? That's what we heard so far? Great, great. What else you heard?
Chop it up.
Okay. Chop it up, that's right.
How do I get that chop it up? What was it?
I didn't hear you, what you said? Access the podcast. You can go online. Hopefully someone that's younger or some, you know, we can help each other. It's called the Chop It Up Podcast. So we're on Instagram, Facebook, just type it in the Google search, the Chop It Up Podcast, and it will populate. All right? So you said you heard that no silly questions. That's right. Any question, and you can certainly go to the Elmham Health table for any questions you have, whether it's long-term or otherwise, right? And they're willing to, ladies, wave your hands again. They're right there. All right? Awesome, awesome. So let's talk about how imperative it is to receiving long-term care for seniors. How imperative is that, receiving long-term care?
Yeah, it's imperative for seniors to receive long-term care because, as you know, as you get older, unfortunately, our bodies are not as strong as they used to be. You begin to suffer different challenges along the way throughout life, and you'll find that traditional healthcare services don't cover a lot of the hospital care needs that you have. And so let's say, for instance, if you only have Medicare only covers 80% of your medical costs, in which if you have Medicaid, it covers the other 20%. But unfortunately, as you learn throughout life, dealing with a lot of the medical costs, Medicare doesn't always cover your long-term costs, unfortunately. Let's say, for instance, even just to go to the hospital in an ambulance, it's going to cost you like $1,000 just for a trip to the hospital. And a lot of times Medicare don't cover that, so it has to come out of your pocket. So if you have long-term care through Medicaid, it covers a lot of those costs with it that you wouldn't have to come out of pocket for. So it addresses a lot of the needs that you that may arise with a lot of the health challenges that you have within your body, a lot of your economic needs, because Medicaid is a income poverty program, and so it's not necessarily based on your health, but it's based on your income. So if you qualify for Medicaid, it can cover a host of things, including long-term care.
As Reverend Johnny said, managed long-term care is very important, especially as he stated, your bodies are changing every year. Some of us could do more than others, some of us are more fit. It also helps prevention of what? Falling. You have that assistance that someone can go to your home. You're having the accessibility of doctors going and assessing you for those individuals who are disabled or have a hard time getting to the doctor's offices. Long-term care is very important. If you do qualify, you should really look into getting it. We do find a lot of seniors when we're out marketing the community that have these medical conditions and they're not aware of what long-term care is. So we try to educate them in the best way possible and work closely with organizations like these to refer, to do a nice transfer, to get them the resources and benefits that they require and that they're entitled to, because everyone here worked over 10 years. You do qualify for Medicare. Medicare is part of the program to get you your long-term care. And as I was saying to a lady that was in the table, you need to verify your income. A lot of seniors don't know that they qualify for Medicaid, and we have resources to help you apply to get you Medicaid and to get you into the right programs.
So one of my policies when I speak to my patients is it's always better to be proactive than reactive. So when I ask patients, do you know about long-term? Do you need long-term? A lot of the times they say, I'm good for now. And for now is not really a good, way to think about it, because for now, we all know that unexpected things happen all the time. And you don't want to wait till something happens to react to it. It's better to do it, plan ahead of time, do senior planning with a company like Bragg's Home Care to get your Medicaid activated, to get the long-term before something happens. Because when something does happen, it's a rush to get it done, and it's not done the right way. So if you already have Medicaid and you already have long-term care planning in the works, it's always a better option than to do anything wrong. We know that. Okay? So I think that, first you should speak to Bragg's about, the long-term planning and how you can go about getting Medicaid. Proactive rather than reactive.
Absolutely. So what did you hear in this segment? Proactive rather than be reactive. Absolutely. What about long term? There are income criteria, right? Requirements. So don't feel like, you can't do it. Submit the documents and allow them to process it, right? Absolutely. Okay, thank you, ladies. All right, so let's segue into an interesting question. Do I keep my doctor if I can change health plans? Do I keep my doctor? So that's a question that many of us have. Do we keep our doctor if we can change our health plan? Because not all doctors accept certain health plans. So how can you answer that question?
That's a very good question. One of the benefits of enrolling into Emblem Health is that we're two combined companies, and a lot of you guys are familiar with GHI and HIP. So we've been insuring New Yorkers for over 85 plus years, because we are a New York-based plan. So what does that mean? That our biggest network is in New York. We're not outsourced to other states. And the same doctors and specialists that we insure, our teachers, our firefighters, our police officers, you have access to those doctors. Before conducting and signing up with a health plan, and this is very important because I can't begin to tell you how many times we sit down with seniors and they said, okay, I was enrolled with a plan, but I got this card, I don't know how I got it, it's not my doctor. You need to make sure that the individual, the representative, first and foremost, checks your PCP. A lot of times we've been seeing our doctors since we've been very young. We're going into, our 20s, our 30s, And to believe it or not, we're kind of married to our PCPs. Although once you start getting older and you start developing some medical conditions, you're now seeing different specialists in some individuals. But a lot of times, a lot of health plans and marketers do not do their due diligence in checking your provider if it's part of the network or your specialist. We thrive on that. We want to make sure that if you do change health plans, that you have a seamless process. What does that mean? That yes, that you can continue to see your primary care physician, that you continue to see your cardiologist, your OBGYN, your dental provider. All of these components are very important when you're continuing the quality of care, and it's very important that you don't change if in fact some people are not happy. We ask them, are you willing to change your PCP if he's not part of the plan? Sometimes people will say no, sometimes people will say yes, because they'll find something that's more convenient or closer to their home. We also find that a lot of individuals are just comfortable with going to clinic-based settings as in hospitals, and they're not aware that there's doctors in private offices within walking distance of their home because they're so used to going to a hospital to get the care they need. What does it mean? That you're seeing a lot of, there's nothing wrong with that, a lot of internists, a lot of people who are going to school to be doctors. So 9 times out of 10, you probably see your PCP in the hospital maybe once a year, if that, and that's for your physical. But again, it's very important that when you enroll with a plan, that representative does check to see if your primary care provider, your specialist, is part of the plan before you enroll, not to interrupt any services, because we see this all the time. You'll be scheduled for surgery, and then you'll enroll in a plan, and then that provider does not accept your plan. So what does that mean? Then your surgery is canceled, and then it's prolonging. Now you have to wait for another authorization. So this is why, again, it's very important that you sit down with someone who knows what they're doing from A to Z and checks and is very thorough. We are as thorough as checking even your medication. Every time we have an appointment, we let our seniors know, please bring, if you don't know the names of the medication, that's fine, bring the bottles. We'll check. We have to identify and let you know what your out-of-pocket cost is going to be so there's no surprises.
All right, thank you so much. All right, you already know I'm going to ask the question. What did you learn? What did you hear? Out-of-pocket expense, absolutely. And what I heard, and I took some notes, ensure, and this happened to me as well, check. If you enroll in a plan, check to see if the provider accepts the plan, because you don't want to have any unforeseeable charges, like Reverend Johnny said. How are you guys enjoying it so far? Yes? Very good, very good. Thank you so much for doing this as well. All right, so, any questions? Can we do a little Q&A? All right, let's do some Q&A. Switch it up a little bit, all right? Do you guys have any questions? If you have questions, you can raise your hand and stand and ask the questions. This is your time. Any questions about health? If you have a comment. Yes, ma'am, you can stand up. Very good question. All right.
I love that question. You know how many times I tell my staff and when we're out there marketing, don't think that just because someone's over 65 that they're the only ones who qualify for Medicare. That's not correct. If you're permanently disabled for over 24 months, you can apply for Medicare if your doctor deemed you as permanently disabled. But there's a waiting period of 24 months. What does that mean? We've seen people with Medicare that are 30, 25 years old that unfortunately probably had an unforeseen accident or something, a trip and fall at work, or there's many situations that we come across young people who do have Medicare, and we do insure and we do enroll people who are permanently disabled. They are entitled to the same benefits as someone who would be retired or turning 65.
Also, our company, Growing Home Care, we service patients that are 21 and older.